A huge day for the stock market today, and it's all because of that vaccine news from Moderna. Big deal here. A vaccine that's 94% effective, at least. We'll talk to Dignity Health's Dr. Nicholas Testa about the vaccine. How does it work? Who gets it? When do we get it? Got lots of questions for him. Stay with us. Dow hitting a new all-time high, driven by encouraging developments on the COVID-19 vaccine front, this time from Moderna. The Dow up over 470 points today. Moderna announcing their vaccine has finished phase 3 trials. It's found to be 94.5% effective. Remember, this news comes just a week after Pfizer announced its vaccine was 90% effective. But here's a big difference. The Pfizer vaccine needs to be stored in specialized freezers at about 100 below zero. The Moderna vaccine can be stored in a normal freezer, which you have at home, which makes it a lot easier to store and distribute. For more on the big news from Moderna amid a surge of cases and hospitalization, let's go to Dr. Nicholas Testa, who's the Chief Medical Officer with Dignity Health. Dr. Testa is an emergency medicine physician. Thank you so much for joining us. Doctor, let's begin with your immediate reaction to the Moderna vaccine news and sort of put this moment in perspective for us.
Cautiously optimistic, right? We love hearing about another vaccine, but let's all remember that this is data being released in a press release. And in the scientific community, we don't operate off press releases. We operate off of peer review literature. So the two big things that are going to happen for Moderna next is they're going to apply with the federal government for an emergency authorization, and then they're going to submit it for peer review. So a bigger group of scientists can look at it.
It's looking good, though. It really is. I mean, Dr. Fauci said if he achieves 70% efficacy, he's going to be astonished. Here we are talking about 90 and 95%. Hopefully it will pass peer review, but it would be weird if it wasn't at least in that zone. But the questions my patients are all asking me is, where do I get it? When can I get it? How do I know if I'm in the population that can get it? Particularly, I have a lot of older patients calling, asking for it. Where do they go? How do they get it? How do they know?
So in time, it's going to be readily available almost everywhere. But I think what society needs to realize is many of your patients, Dr. Drew, are not going to be the first ones to get it. The phase 1 group are going to be frontline healthcare workers and patients who are high-risk nursing home patients. Second wave, third wave, if the timetable stays, will probably be somewhere around February, March, April. And it's going to be available, from the way that I'm seeing it, at most pharmacies and drugstores, as well as healthcare providers.
So it's going to be kind of like what you see for a flu shot, right? You could go into a CVS or a Walmart or for different places where you might get a flu shot, and they're going to have it there.
Two-parter, though.
And the concept is it's going to be free, right?
Not free. Yeah, the goal is to make it free. There is some question about whether there'll be charges for administration, but I know everything that we're doing is to make it as affordable and accessible as possible, right? We all need to get back to life as we know it. So it doesn't benefit anyone to overcharge for it.
I want to get a little more clarity on strictly nursing home patients. I've got lots of patients over age 85 that really are at risk, that are out in the world, that are probably more risk than a nursing home patient.
And those patients will be front and center. And there's phase 1, phase 1A,
where do they
1B,
go?
and 2.
I've been told that you can get it from hospitals, only hospitals where I'm on staff. Where is that going to be distributed?
The first round will be at hospitals. Okay. But then from everything I'm seeing, a big center point are going to be urgent care centers and then pharmacies. Now, the challenge, though, is that right now we have 2 vaccines out there, neither of which we know which is going to be sort of the leader. One requires supercooling. So a lot of places won't have that. So what I think we're going to see is some vaccine being distributed in places where we have ultra cold freezers, and then other vaccines being distributed at like a common pharmacy or something like that.
Interesting.
Not like the government's going to pick one winner, like we like the Moderna one better, so sorry, Pfizer.
I don't think so. I think what's going to happen is it's going to declare itself over time. And I think, remember, these are only the first 2 vaccines. It's going to be an iterative process. We're working with mRNA vaccines. This has never been done before. So I think that, you know, once we start seeing, because we're going to study all these patients, too, that we're giving the vaccine to, and it's just, you know, there's going to be more and more vaccines that we're going to be hearing about.
Let's talk for a moment, if you well, go ahead.
I've got to ask this. Are you going to get it?
Yes.
Me too. Okay,
right.
Go ahead.
Let's talk for a moment about hospitalizations, because that's been an area of so much concern, especially at the beginning of this. How are you guys doing on that front in all your different hospitals?
Yeah, so we monitor our COVID population in the hospital really closely. And I'll tell you that we're up about 50% from where we were 2 weeks ago. Wow. And if you look across the county, that matches county hospitalization rates. County hospitalization rates are up about 40%.
50% from 2 weeks ago. That's quite dramatic. Yeah. But how are the outcomes for those folks?
Well, that's the other interesting part of it.
Yeah.
Month after month, we're seeing our raw mortalities go down from COVID. And then when you look at and I just before this preparing, I looked at the county COVID mortalities also going down. So I think we're getting better at treating the disease, and we're seeing in a younger population, which is all good, but should not lull us into a sense of security, right? This is still very serious. Capacity will always be a challenge for us.
All right, very interesting information there. Thank you for all the life-saving work that you do day in and day out as well, Dr. Nicholas Testa.
Thank you, sir.
Thank you.